investigative team. From Toronto, let's look live next at the White House. Another story
change our
tracking through the day. Donald Trump set to make his first appearance today in front of the media since Democrats started moving quickly yesterday to make peace for a second time. Trump will visit a section of the border wall in Alamo, Texas, a community on the Mexican border. It's not the site of the famous battle in San Antonio with its connotations of last stand. So keep that in mind. Trump himself, though, under a new siege in the Congress, and our senior Washington editor Lindsay Duncombe joins us now to look at that. We have a better idea this morning, Lindsay, of the timing for that second impeachment of Donald Trump. You were telling us that at this time yesterday.
Ito lang mga cars.
Well, what's going to happen today, Heather, is there will be a vote on urging my friends to vote the 25th Amendment with the cabinet majority, but that is not expected to go anywhere because Pence has indicated that he isn't interested in going that route. So that's why there's such urgency around this impeachment effort. We believe there will be a vote on the House floor to impeach this president for the second time on Wednesday morning. And the urgency of that was described by the impeachment article sponsors. Here's what they have to say.
Donald Trump incited a mob that attacked the Capitol. They were looking to assassinate Speaker Pelosi. They were looking to hang Vice President Pence. They were hunting for lawmakers.
So we know what is expected to happen in the House, but it is the Senate, Heather, where there is a lot of uncertainty and complication because the Senate is not currently scheduled to come back until the day before inauguration. That is the 19th. Right now, the House Minority Leader, the Democrat, who will become House Majority Leader, is trying to see if there's a way that they could come back early because once
dito ng car ko, papasok na for change oil. Buti na lang may open.
Is that trial would supersede
Yeah.
other business, and if it happens after inauguration, after Donald Trump has left office, then that means the efforts to remove Donald Trump from office after he's gone and to prevent him from running again would therefore supersede the efforts of the Biden administration, cabinet confirmations, as well as coronavirus relief. So we see the idea of can they come back early? We don't know the answer to that. Is it possible to split the senators' days, have them work on a Senate trial in the morning perhaps, and other business in the afternoon? All of these days are under
Malaki din itong ilang shop. Canadian Tire sa Upper James.
Last year, that's one thing. But you add these other complications and it certainly becomes ever more volatile. What we don't know is how to predict what Republicans are going to do. After years of knowing that they would line up behind Donald Trump, it is not necessarily the case right now because the message from Republican allies of the president is not that he doesn't deserve to be punished necessarily or that his behavior wasn't horrible.
That's my car.
Consequences of taking these
change
steps
over.
at this late stage in the game with just 8 hours to go. Could they potentially further inflame his supporters at such a volatile moment? The argument from some of those supporters is just wait it out. So certainly that is the lay of the legislative ground at the moment.
So interesting, and added to that, if I'm not mistaken, Lindsay, Republicans are also going to come forward with a movement just to censure. They don't want to go as far as that, and Nancy Pelosi already has said that option is off the table. So you're right. All of these things in the air, and the time is running out quickly because 8 days away from the inauguration. There is as well, in addition to those legislative moves, a lot of talk about potential threats as we hear more about what is being talked about, as we hear about increasingly policing failures during the attack last week on the Capitol. What is the security situation like right now?
It's interesting being out and around in the city where I live because there's this low level.
Always cleaning, because of the pandemic.
Yeah, well, I'm just trying to do my part, that's all.
You mentioned the
Doesn't hurt, that's
concerns
for sure.
about police. There are some reports in American media that there are police officers being investigated for sympathies for the pro-Trump riot. troops here in D.C. We can expect to see checkpoints in and out of the city, potentially. The mayor of D.C. requested and Donald Trump granted a state of emergency to be currently in place. There are other riots that are also not riots. There are other demonstrations that there are raising concerns about violence that are planned in the lead up to this. On Inauguration Day, the sympathizers of the president have applied for permits to demonstrate in areas around. So the situation is incredibly volatile, and it is not just in Washington, D.C., because 50 state capitals at the urging of the FBI are also on high alert. There are threats of violence there too.
Lindsay,
Oh
thank
my
you very
God,
much.
the
Lindsay
state
Dunkel
is
is our
crazy.
senior Washington editor, and there are very important stories that
Coming
will be
worse
coming
and
from you
worse.
over these days to come. You can read more right now about how the Congress is poised to impeach Donald Trump for a second time. That's the first time ever in American history that will happen. What it will achieve. Alexander Panetta has put up an analysis piece for you this morning. It's at cbcnews.ca, right up on the front page. This is CBC News Network.
Closed captioning is brought to you by Lottomax. The next Lottomax jackpot is an estimated $40 million. With draws Tuesdays and Fridays, you can dream to the max.
I've had type 2
Tingnan
diabetes for
lagi
7 years,
oil.
so it's important that I maintain balance and make smart choices. And when I don't eat like I should, I drink Lucerna. It's complete, balanced nutrition for people with diabetes.
Sana wala sila, oh,
is
free
one more choice
diagnostic.
to make easy.
Oh, see?
I found myself unemployed and with a baby on the way.
Pag mag-change oil ka, mag-free diagnostic din nila, test nila. Sa Pilipinas, mabayad pa ka 2,000 kapin.
I get to do the things that I do every day.
At Pizza Hut, we deliver unbelievable value. So unbelievable, we're offering up to 3
Check nila ang
when you buy any lot.
alignment.
I feel it sounds too good to be true, but it's true. Now that's delivery.
Don't let pain slow you down. Tylenol Extra Strength Caplets can help you make the most of your time by starting to work in just 15 to 20 minutes.
Tanan, lagyan nila ng mga
Showing
oil.
you this 30-second ad in just 15.
Kanila ng water.
Fast forward relief.
Lahat. For $50.
Political news show now starts at 6.
Pag mag-special ka, $80. So, 50 lang po kawala.
Tonight at 6 Eastern.
Why kwarta? Pandemic.
In one of the most challenging climates on Earth, life finds a way in our wild Canadian weather. A 5-part series. Friday
Lagyan nila ng wipe,
CBC Gem.
wiper, fluid.
Let's check in with Chris. Nice.
Yeah, we're Happy Valley Goose Bay. That's pretty nice. Beautiful color. Will Goodrich just sent me in this morning, so that was from the past overnight. So Heather, if we can't find winter, we might as well try to find something, right?
Well, that is beautiful. Where are we finding winter in the country?
Asa ka na. Pataas na akong car. Chun, chun, chun.
In Louisiana, with snow on the palm trees, and they had anywhere from it up to 25 centimeters of snow. The New England states, nada. That's where you expect to see winter. You want winter, we got to go west. Heavy rain this morning.
See, ilang gidiagnose. And then, gibutangan nila mga lahat fluids like wipe, sa wiper. Ewan ko anong ipanglagay nila. Well,
Now, on east of the Rockies, these are strong, dry winds, but these could be over
Diyan
100
na.
kilometers per hour down in the southern foothills. And look at those temperatures: 7 in Medicine Hat, Calgary, 6 degrees. So you got
Taas na.
dry conditions east of the Rockies, wet conditions west of the Rockies. And into Saskatchewan, calm today with snow.
pala. See, lagay na nila yung ano.
Redevelops east of the Rockies. This morning, watch for some freezing drizzle. We've seen it around London. We've seen it around Wyerton, Owen Sound area, north of the city of Toronto, bringing some slippery driving conditions. A lot of cloud cover once again across eastern Canada.
What I love about journalism is that every day is different. I never know what stories are going to break and how my day is going to unfold. And that's what makes this job so exciting.
When cold symptoms won't let you sleep, try NyQuil Complete with Vicks VapoCool for effective relief plus cooling flavor.
Itong nakaayo. Eh sige lang drive ko. Nilapas na ko sa kuan. Sa village. Supposed to be mga last week pa. So kaya nga mako-close ang mga shop. Nag-try lang ko karon after my duty kung open ba. Nag-open man di ay. So thanks God. Change oil na karon. At least.
Even the big stuff. You get a delivery experience you can always count on. You get your perfect find at a price to match on your schedule. You get fast and free shipping on the things that make your home feel like you. Wait there, way more than furniture.
It's never been more important to take care of your heart in the comfort of your home. Many people have an irregular heartbeat called atrial fibrillation, which, if left untreated, can increase the risk of having a stroke by 5 times. And atrial fibrillation is most prevalent in those over 65. Now, you can do something about it. CardioMobile, the personal ECG device, allows you to take an ECG anytime, anywhere using your smartphone. Simply place your fingers on the electrode and see your results in just 30 seconds. And you can email your ECG to your doctor with the press of a button, all from the comfort of your home. CardioMobile is proven to detect atrial fibrillation, one of the leading causes of stroke. CardioMobile can also detect normal sinus rhythm. For a limited time, CardioMobile is just $109, a $10 savings. Don't wait. Order today on Amazon or cardiomobile.ca.
Set your goals. Let's get you there.
Saturdays happen. Pain happens. Aleve. Aleve provides fast pain relief that lasts up to 12 hours. When pain happens, Aleve. Fast acting, long lasting.
Alberta Premier Jason Kenney is warning his province could run out of vaccines unless it gets shipments.
Very shortly, our capacity to administer these vaccines will outstrip the projected supply.
Alberta is projecting to be short at least 20,000 doses.
Paubos na siya. Kinuha na yung oil.
To keep up with plans to
Close
inoculate all
na.
paramedics and emergency medical responders.
Pababa
Kenney
na
says this is
yung
not
car
blame
ko.
game with Ottawa, but all provinces have to depend on the federal government to quickly procure and distribute more vaccines. British Columbia is now the fourth province to reach the milestone of 1,000 pandemic
Slowly
deaths.
going
22 deaths
down.
over the weekend brought the total to 1,010. Morgues in the province are at or near capacity, with officials deploying at least one refrigerator truck in the Fraser Health Authority region.
Ang dumi-dumi na ng oil. Diyos ko Lord.
Provincial Health Officer Dr. Bonnie Henry says there is some good
Kasi
news.
lagpas
New
na
cases
sa ano eh.
and hospitalizations are starting to plateau. We have reported for months on how COVID-19 has put tremendous pressure on the frontline healthcare workers across this country. This morning, we're getting new research that shows the feelings of burnout already very high among nurses, doctors, and other health professionals, and this is before the coronavirus hit. So Laura McQuillan joins us. She's taking a closer look at these findings. Good morning, Laura.
Morning, Heather. What this research shows is the impact that healthcare worker workload, the conditions of work, the stress at work is having on them mentally, emotionally, physically. So some new details
Air
out in
satire.
this survey, which will be published in the Canadian Medical Association Journal today. It surveyed staff at the Cardiovascular Centre at Toronto General Hospital about how they were doing pre-pandemic. And what it reveals is this. Nearly 4 out of 5 nurses reported feeling burnout in the months before they took part in this survey. And then they looked at what are called allied health professionals. Nearly 3/4 of them, that's therapists like occupational or respiratory therapists, pharmacists, social workers, those wraparound roles inside the hospital. And then looking at physicians as well, 65%, so fairly high numbers there. And according to Dr. Gary Rubin, who led the research on this, he's an excellent surgeon, he believes those numbers are very high and very worrying.
I was really concerned about the impact that burnout has on both the care that our healthcare providers give, doctors, nurses, allied health, and on the impact of burnout on their own mental health. And what we know now is that if a nurse or a physician is burned out, it's much more likely that the patient they're taking care of is going to have some sort of adverse event.
And in terms of what burnout means, you may have experienced yourself. It's those feelings of stress, exhaustion, reduced motivation because of what you're seeing at work, because of the way your work is impacting you. And the message from research is that is having a big impact not just on those staff, but also on the patients that they're treating with it.
We're hearing from healthcare workers, Laura, about what things have been like since
they're
the
good.
pandemic began, and what it's been like through these past 10 months.
I don't care if I
the situation that they were already facing.
pay
well, it really
much more money
look at that sense of burnout
than changing in a
pandemic. Now we're seeing healthcare workers faced with the added stress of having to go to work every day and
Colorum.
because of this virus. That was
Changing
a very
oil.
unknown virus. They didn't know how to treat people.
Mga 25 lang,
People
anak.
working extra hours, extra shifts.
Marami naman dyan eh. Mag-change oil, $25 lang.
But of course, staff are needed to care for all those extra patients.
Kaibigan. Pero mas maganda pag dito kasi i-check lahat. Yung alignment, yung tire.
The union telling us that many are struggling with stories of crying between call-outs, fear every time they
Sine-check
go
nila.
to treat someone. Also, personal support workers that long-term care, working in a really desperate situation a lot of the time, and short-staffed there as well. We also heard a first-hand account on this story.
Labi na og ka na last sa winter. Wala, makuha lang yung yung air. Ano sila. Madaling mawala yung air. So nga, singan mo, nagdagdag siya ng daming air on. Kasi pag winter,
when I came home, I would be in the garage,
daling mawala yung air.
stripping down, putting alcohol on myself, then going up and, having a shower before I could even hug my kids. My kids have become so programmed now that they ask me, can I touch you, Mom? Do you have coronavirus? And that really breaks my heart.
And that heartbreaking situation just added to all of those.
I want to give her tips because it's good.
The man behind this research wants to redo it, do a new survey now in the midst of the pandemic to find out what the situation is like with some quantifiable data. But there is a sense from healthcare workers that even without that data to back it up, they feel that not enough is being done to help them out.
Lauren McQuillan, thank you very much. Ottawa, a focal point for us in the next hour and through the day. CBC News has learned there will be a cabinet shuffle this morning and a virtual shuffle at that because of COVID-19. Innovation Minister, according to CBC News sources, Navdeep Bains, leaving his position. He's in fact just released a video statement saying
Ito mayroon sigurong kasi isa madali lang yung nilagay. Itong sa front, daming air na wala. Yung isa, wala lang. Kini-check lang niya. Tinining lang niya yung gauge. Then, wala. Kina-close ka agad. Ang isa wala. Tagal siya doon. Doon sa likod, sa kabila. Walang gas. Wala na. Wala na. Dali. Ito lang isa ang perfect, walang air na lumabas. Yung sa kabila, sa left side, at sa mga front tires. Okay. Thank you. Tapos na. Yay! Lagyan na lang ng oil.
You get a home phone line, unlimited high-speed internet, and TV with all your favorite channels, all for only $89.95 a month. Call now and get 6 months absolutely free. Be like hundreds of thousands of way.
So let me get this straight. I get a home phone
Accept pa sila dito ng tips. Ayun ko.
TV with over 70
Siguro.
All for only $89.95 a month.
Pwede naman siguro.
Internet and TV with all your favorite channels for only $89.95 a month. Call now and get 6 months free. That's right. Your home phone, unlimited internet, and
Lagyan ng kinbigyan na ng pang coffee. Kasi ang galing niya. Coffee lang.
Call 1-866-217-3563 and join the wave.
This is Manulife
Ito nga mo.
News. And now, here's some good news.
Ang galing.
More people are taking little steps to financial security with Manulife Cover. Canada's best health and dental
Kaya,
insurance
kukuha siya ng
provider.
oil. Saan ka sila kukuha ng oil?
That's right, Peter. Manulife Cover Me Health and Dental is comprehensive and
Baka oil to. Nandito sa ano. May gauge dito eh. May mga ano, parang gasolina doon. Pang gasolina. Siguro ito ay yung ano, galing sa taas. Ito siguro ang oil. Kasi dalawang klase, special at saka ano, ordinary. See? Yeah, ayan pala. Itakar ako. Kinuha na niya yung ano, post. See? Magana. Yeah, ayan pala. Dami siguro dyan. Para din gasolina. Magana. Ayan pala. Itong isa special pala yan. Ang isang tube. Yung isa, ordinary.
Buckley's Complete Plus Mucus. It tastes awful and it works.
I hope my daughter chases her dreams.
Finish.
Just like her great-grandfather
Good
wanted.
job.
He was a hockey player who I learned through ancestry, followed his love of the game around the world.
Get to know your family story. Ancestry.ca.
Hindi tayo na.
Guns and gangs. Detective Kelly, duh. Drug squad. I had no idea. It's so weird that we haven't met yet. Do you mind if I get back to arresting this guy?
I finally find my way into this case only to find one of your drug squad detectives is trying to take it away.
Ini-check nila lahat yun. Kung may problema, sabihin nila sa akin. At saka, sila mag-repair. Kung nakikwarta, mo i-repair. Kung wala kang pera, dalhin mo yung car mo. Sabihin mo lang sa kanila, next time na lang. Yun ang tama i-diagnose nila kasi kung alam nilang may sira, ipaayos mo naman. Yun nga free. Dun sa Pinas, wala. Bayad ka ng diagnostic test. Dito, free. Kasi pag may sira, sila ang mag-ano. Depende. Ang pagawa mo sa kanila, ang hindi. Yun na si Upang. Kalbo. Pinaano na niya. Handa na niya.
Some of the restrictions that Ontario is considering, a second state of emergency to give the province broader powers to act more quickly, doesn't need legislative authority.
Dumi-dumi na ng car ko.
Shorter hours for essential businesses,
Dapat ang washing na naman.
to a maximum of 5, limits on construction and manufacturing, the number of people that work in offices.
Okay,
What is
tingnan mo.
missing, we expect, no mention of curfew,
Ang layo na ng
such as
ano.
the one that Quebec is now
Ilagay nila ng ano, magkano o kailan ka mababalik dito. Ilagay nila yung ano, kilometers pag kailan ka mabalik. Lagay nila doon sa ano, sa front
Good morning, Dr. Bogosh.
shield.
Vaccination, that's what I want to talk about with you because if you were watching us last week, Dr. Bogosh expressed what
Test na nila.
Dr. Bogosh, the majority
See?
of Canadians feel, and that is they are
Yung tama ba yung oil na nilagay?
going nationally and the speed at which it is being conducted. And you promised, if I bring your words back, that there would be a big jump in Ontario's progress in getting needles into people's arms by this week. So let's look at the numbers together, okay? We were talking to the Ministry of Health officials, and this is what people can see online. There's a daily total put every day. So
Sira din yung Canadian car nila, oh. GMC car. Canadian Tire car. The white one. There, the white one.
Okay. hold that number in your thought because
Alam mo tong smart?
the ministry also told
Smart
us
car
this,
na
that
maliit.
Ontario has had 142,000
Ang
doses
mahal
of the
kaya
Pfizer
ito.
vaccine,
Ang
53,000
liit-liit.
doses of the
Mahal
Moderna
yan.
vaccine.
Kasi Mercedes-Benz daw ang may gawa sa smart na
More
car.
than 70,000 doses more than
Ganun
what
lang
gone
yan
into
siya.
Ontario
Pero ang
arms.
mahal.
So there still is a deficit. There still is
Dalawa lang kayo. Diba? Tingnan mo, ang liit-liit.
Are you satisfied with where things are 1 week
Mahal
later?
daw to eh.
Well, to be clear, I won't be satisfied
Kasi
until I
Mercedes-Benz
find
ang
an
gawa.
vaccine that wants
Ang
the
gumagawa.
vaccine. So let's make that clear. I think the other important point too is, yeah, there's still room for improvement. It's gotten better, but
Nandoon
there's
si
still
ano.
room for improvement. The third point is that number that's hovering around the 8,000 or 9,000 is certainly a lot better than when we were seeing out 3,000,
Galing ako sa duty.
4,000 vaccines per day.
Paga
It
dito.
actually might be an underestimate
Gutom na.
because there's
Parang
a huge sweep to vaccinate
nagreklamo ng
those in
tiyan ko.
long-term care, and the numbers
At saka
accounting for
parang
those getting
nahihilo din
vaccinated
ako.
in long-term care takes a little bit of time because
Mag-drop by pa ako sa Walmart kasi magbili ng water.
So that's an underestimate.
Yeah.
But even with accounting for that underestimate, can we do better? Absolutely. Should we do better? Absolutely. Should we get all those vaccines out of the freezer? Absolutely. You've
Oh,
got to be faster.
3,000
But
for
I agree with you. I still
straight
think there is room
days,
for
for
improvement.
8
So
days.
I'm
Oh
wondering
my
if this might be a
God.
mechanism. We have some pictures.
For
Of
8
course, Los
days,
Angeles and
3,000
California
pieces.
is such a
Well,
hotspot
tapos
right now,
na.
but what we're hearing from
Hey,
the
thank
region
you.
is that Dodger Stadium is
Bayad na
becoming
din
a
ako.
mass vaccination
Tapos ng
center.
bayad.
Disneyland is opening up to mass
Nilalabas na
vaccination
nila yung
as a
car
site.
ko.
Now, Toronto, we learned,
Then
Metro
magbayad,
Toronto
ibalik ang
Convention
key.
Center is opening up next week and planning to do about
That's it.
250 shots a day.
See, nalagaan talaga nila.
One of these super sites in Winnipeg. Is this the model for Canada? Is this something that we need to turn to more aggressively to bring the numbers up?
Yeah, it absolutely is, and it's great to see that the convention center is going to open up. And you think about 250 vaccines a day. Sure, it's better than nothing, but at least you have the potential to scale on a massive
Bait niya.
with a
Bigyan ko
place
siya ng
like that.
tip.
And initially, it's going to be for healthcare providers and
Baka may pera ko dito.
people that come in. But yeah, it's actually, you can see how a place
May
like
pera
that
si
can
Chinita.
rapidly scale and care for the bigger
Bigyan ko
community.
siya
I
ng
think the
tip.
other important point to note
Diba?
is you can't run a vaccine program for millions and millions and millions of people out of 19 or 20 nodes within the province. And when supply allows for it, this is going to expand to places where people are comfortable getting vaccines and are known to get vaccines, such as the primary care physician or the primary care clinician. I mean, public health units, the pharmacy on the corner, community centers. So that's all in the plan. When we start to see a massive supply of vaccines, this is
Bigyan lang ng 10. Diba?
of where people can get it.
Tama na tong 10.
So that's a question. I'm just reporting that Alberta has said to Ottawa, we're going to be out. We're going to be short
For
40,000
coffee.
doses at the start of next
Balik
week.
naman yan.
And again, if I come back to the information that we got from the ministry in Ontario, that initial shipment, they used that up and they've exhausted what you got last week. So I'm wondering, is there a problem that you foresee with supply?
Maybe there's a problem and not a problem. We know that the federal government is going to give the provinces a set number of vaccines. We know that there's sort of this weekly allotment of vaccines from the federal government. And you could plan around that. And then, of course, we're expected to receive a much greater amount of vaccines later on in the winter or in the early spring.
Siguro hindi sila mag-ano ng pera kasi ang dumi. COVID, diba? Baka hindi tanggapin. Siguro hindi tanggapin yung pera. Kasi ano eh, may COVID ngayon, diba? Baka ma-offend lang ako.
Yes, we'll probably see the additional centers pop up to really help vaccinate people in Ontario, and I'm sure this is going to be the model elsewhere in the country.
So, ang na-vaccine na is 122,105 vaccine doses administered na in Ontario. So, ang 8,859 doses were administered yesterday. So, dama pa lang.
Do you have enough syringes to do this, for example?
Bait niya.
I think we do, but quite frankly, I really defer to some of my colleagues who are part of the supply chain management side of things. But I remember, like, when, for example, well before we even had a vaccine, I think this was sometime in the middle of 2020, I recall the federal government had purchased, like, tens and tens and tens of millions of syringes in preparation for a vaccine that didn't even exist yet. So there certainly has been there has been care to really address logistics. Whether or not it's implemented is of course another thing. But certainly there should be shortages of syringes that have been accounted for. In addition to that, you would hope that from coast to coast there would be the organization set in place, the logistics set in place, such that when you do receive a massive supply of vaccines, you can rapidly integrate that into the vaccine program. You can rapidly accommodate that massive influx of vaccines so that you've already done your heavy lifting. You've already prepared your primary care clinics, your pharmacies, your public health clinics. You've already set up your community centers. You've already communicated to the general public that this is on the way, and here's how you sign up for it. You already have your sign-up tools so that people know how to get their first dose and their second dose. Like, there's a lot of heavy lifting that needs to be done in order to accommodate this future, hopefully near future, rapid ramp-up of vaccination.
Dr. Bogosh, to be continued, undoubtedly. Thank you for this morning, as always.
My pleasure.
Power and Politics has gone prime time. Canada's premier daily political news show now starts at 6.
Nasirado sila, oh. Sirado sila, oh. Wala. Close ang tindahan. Pang may mag-order. Ito, oh, 199. Save 59. Nag-sale sila. Walang nagpa-change ng winter oil kasi walang mga trabaho. Winter tire. Mayroon pala siya ano dito, oh. Parang may hole. Buslot. May mga buslot, oh. Ganun pala ang winter tire kasi ang ako kay all season naman ang ako.
Okay, so the vehicle's almost done. The only thing he's recommending is the air filter change.
Okay.
It would be the same price as you installing it. So you only pay for the filter.
Yes.
Pretty
Okay.
much.
Can you change it?
Of course.
Okay. Thank you so much. Tingnan mo, change nila ang filter. Pero walang bayad. Bayaran mo lang yung amount sa ano. Yay! See, change nila yung filter. Oh, walang bayad daw. Bayaran mo lang ng amount ang ano. Oh. See? Ang bait nila. Tingnan mo. Oh. Tine-check nila lahat. Oh my gosh. See, I'm happy. Ang dumi-dumi na ng filter. Oh. See?
Reverse mortgage makes it easier to access it. And best of all, you don't have to leave your home.
Ang dumi-dumi na ng filter. Oh my God. Thank you. See, tapos na. Change ko na lang filter. Bayaran ko lang yung filter. See, magbayad ka natin. See? You're the best.
No worries.
I love it. You check everything.
Yep.
That's why I want Canadian Tire for change oil. I always here.
It's done proper, yes.
Properly done. And then I can give a little bit like tip for the guy, right?
You're not supposed to, but if you want, you can. Yes.
Yes. Okay.
If you get the chance, go online at canadiantire.ca. There's a survey.
Yeah.
A quick survey you can fill out, and then.
Okay, I will do that. Yeah. Great. Thanks. I will do that. She's so good. Give it to him.
Damn.
Yeah.
John, she just wanted. Oh no.
Joe, for coffee.
Okay. Thank you.
You're welcome.
This is Sean.
Sean. Okay, I will ask Sean. You.
Canadian Auto Service, Paul
Yeah.
speaking. How can I help you?
You did it great. Thank you for checking the filter though. It's too dirty. Oh.
Yeah. What kind of trouble?
Good that you check it.
Okay, well, I'm sure we're basically taking one that's like, when can you come here? It's not turning over at all? Is it turning over at all? Yes. I see, okay. Yep, well, whenever you get here. Yeah.
Do you know when you will open?
We were told like on the 28th.
Oh.
We should be seeing a reopen possibly, but they might extend it, right? So
Yeah.
I'm not too sure either.
We don't know.
Yeah.
I'm gonna put you in on the schedule, just tentatively and for 11 o'clock.
Second time like down. Second time around.
Yeah, I know. It's been a bit.
Yes.
So I got Nat, the office. At 51 Collins.
So did you immunize already?
I'm sorry?
Are you immunized? Not yet.
Not yet, no.
Not yet.
Still getting there.
Yeah. Thanks, God. I will pay Visa.
On Visa? Sure.
Yes.
Keys there. So after taxes and everything like that, I got 8016 there, okay?
Oh, that's good.
Perfect. Whenever you're ready. Perfect.
Thank you so much.
Oh, no worries, okay? Perfect. Here's the receipt. Okay,
Yeah.
make sure you stay
Have a
safe.
great
Okay.
day.
Perfect.
Yes.
All right. Take
Okay.
care.
Okay, I will. Thank you. You too. See? Done. And I will go to Walmart. Oh, see, Canadian Tire Part Service. See? Okay. Kilala ko to. Ay, ay, ay. See? Punta na ko sa Walmart. Ay, ay, ay. Kuha ko ng tubig. Wala na kayong tubig sa balay. Sa bahay, walang tubig. Inon tubig na inumin. Sorry, kabok. At least na-change ang filter. At saka walang bayad. Nagbayad lang ako sa amount ng filter nila. At saka chine-check yung tire. Yung front left side, ang daming walang hangin. Nilagay nila ng daming hangin. Air. So sa back, sa left side, nilagyan din. Sa left side back, wala. Hindi na kini-check lang. Asa sa front din. So weird. Yan pala pangit drivean yung car. Kasi kulang yung hangin sa front at sa back. Sa kabilaan. Sa front, sa left side. Ang sa back, sa right side. Walang hangin. So dapat check sana ng once in a while kasi especially like winter time kasi mawala yung hangin sa gulong mo. Okay guys, I will go now to Walmart. Going to drive to Walmart. So nilagyan nila ng bago, oh. See? Tinang na nilagyan nila ng bago. So dapat daw July ang change oil. So mga 8 tire. Mga 10 mga ngayon 9. So 10 mga 10. 103. Oh my god, palaging nagda-drive. Dami mag-drive sa car ko. Kasi pagdating, drive si Paulo, drive si Susili, drive yung boyfriend niya. Wala. So bye guys. Sana manood kayo. I-ano ko to, i-download sa YouTube. Kasi hindi na ako nagda-download sa YouTube ko. Hindi na ako nag-upload. So mag-upload ako sa YouTube ko. Okay, thank you. Bye guys. Going to drive to Walmart. See you in Walmart.